I am an epidemiologist, it's true, but actually today I'm gonna sort of try to step back and have three coherent, more or less philosophical thoughts that have come about because of COVID. And I'm hoping that will lead to wherever you want it to go. But this is not gonna be a medical chat. This is gonna be thinking about our world and what COVID has meant for it. And it's my intent to speak for 30 minutes, maybe 40 minutes, and then afterwards we'll take all the questions you want. For those of you who are going to get really upset or really bored before the end, my three coherent thoughts are, wow, we have some structural injustices in the world, more than we're talking about on the news these days. Wow, COVID has really shined a light on that in the world's poorest places. And finally, I know that most of you are really depressed and thinking the country is falling apart and governance has never been worse. But oh my gosh, if we step back and look, Central New York has done a great job in responding to COVID. I can't remember government ever working better than it has with COVID in Central New York. And so with those sort of preliminary thoughts, I'm going to start, if you don't mind. And I'm hoping that right now, Bill.
Yep.
That
it says you start. Yep. We see your PowerPoint presentation.
Great. Okay. So most of you know this, but I'm not sure you know just how dramatically the world has gotten better over our lifetimes. Here is a graphic showing the infant mortality rate starting in 1950. And for the world as a whole, it's in blue. That's the one that's sort of in the middle there. And this blue line has more than cut in half from 1950 to 2000. Wow, have a lot of things gone right in the world. And like, I was inspired to go to public health school at Tulane in the 1980s after going to East Africa and seeing women carrying water on their heads in buckets for hours and hours every day, and then hearing about how many Kenyan kids died of diarrhea because of dirty water and inadequate sanitation and inability to have enough water to clean themselves. And wow, have the numbers gone down since I went to Tulane. And remember that in 1985, when I went to Tulane, the world had only about half the population that it does today. So we've had something like a six-fold reduction in the rate of diarrheal deaths across the globe. And here's a graphic showing several other things. That top line is influenza and pneumonia. The next line down is measles, then scarlet fever and typhoid. There are a host of diseases that over the last century have dramatically reduced the rate at which they kill people. And, you know, sitting in Central New York, we don't really notice that because for us, most of the benefit happened from about 1890 to about 1930. So it happened kind of before our clock. And we don't think of all the advantages of having plentiful water in the home or all the amazing advantages that the arrival of electricity brought. Here is a graphic, and it's showing what the World Bank defines as poverty, which in today's dollars are about $1.90 per day. And when we were born, maybe 2/3 of the world was under the World Bank's poverty line, and now it's only about 12 or 13%. Wow, what an astonishing thing. So when I show you these graphics showing that diarrhea has gone down and deaths from pneumonia and influenza have gone down, I actually can't tell you how much of it is my little medical world doing a better job and how much of it is just poverty going down and people suddenly having refrigeration and water piped into their homes and all of those other things that come with not being extremely poor. And if I'm honest, I don't fully know what the word poor means. Poor, for most of us, is an income word. But in my mind, having spent a lot of years, mostly in war zones, in the Democratic Republic of Congo and with Mozambican refugees in the Central African Republic and elsewhere, poverty seems to me something a little more social, something a little more structural. On the left is a picture of a child who, when the picture was taken, was 6 years old. I'm going to talk in a little bit about a surveillance project I have going in the Central African Republic. But I've told my 2 monitors who go around and collect the data that if ever they see someone that's really, really sick, please just pay for whatever it takes for them to get treatment, and I'll pay them back later. This child on the left was born, or very shortly after birth, had a hernia. And it resulted in, essentially, you'll now see, swelling in their testicles. And this child couldn't run. They just did not live a normal life. So when this guy, my monitor, was visiting in this town, and the mother talked about the problems of this child, he wasn't even someone in our study. He was just someone who lived in this town. My buddy, Philip, said, okay, well, tell me next month when I'm here how much it will cost to get it fixed. And the answer was it cost $80 for the transport, the surgery, the 2 days in the hospital to get it fixed. And so he gave the woman $80. She had it fixed. And he said it was stunning how in the village, in the months that followed, people not related to this child at all would come up and thank him. So my point here isn't that $80 is little money. $80 is a lot of money, but the notion that in a village of 1,000 people, raising $80 was an insurmountable thought implies to me that it's something more collective. On the right is a picture of a young girl, and she is very dehydrated. One of the main ways you tell if someone is dehydrated is to take some sort of fleshy part of their upper arm and pull it up and twist it. Sometimes you can do it on their belly and see if their skin bounces back. And when you pull a little bit of flesh and twist it a little bit, if it stays standing up, it's called tenting. That is a classic sign that someone is very dehydrated. And so I did that with this little girl. She was very dehydrated. You'll notice she's also malnourished. And her father said she's not thirsty, she just won't drink. But I tried, and I took out my little water bottle out of my bag and I offered it to her, and she started drinking, guzzling it down, and then blah, she threw up. And I said, oh, sir, really, this girl is very acutely malnourished. If she's throwing up when she drinks, she really needs to go to a clinic right now. He said, okay, I will take her. And off I went. We did our work. At the end of the day, we're coming back, and we just stop into this house, and the little girl is still there. And the father comes running from the field, and he says, well, I started thinking about it in our clinic. It isn't working. They don't have any drugs, so nobody goes there anymore. And now I'm getting sort of really impatient. And I said, please grab her, come with me. And he came with us. We put her in the IRC car, and we took her to a clinic. You know, was this girl destined to die because her father didn't understand how severe her malnutrition was? Sure. Is this girl destined to die because in this war her mother had already died? Sure. Was this girl destined to die because the health system essentially had collapsed and the only clinic within walking distance was no longer working? Sure. That's not just dollars, though. That's some terrible interaction of all the things that were stacked up against this child. And that's what makes me a little more confused about what poverty means. So I'd like to go through a sort of offensively shallow exercise for just a moment. And I'd like you to pretend, just for 2 minutes, that there are only 3 mechanisms of structural injustice in the world. Let's pretend that all of those structures that work against certain people and that keep other people from blossoming, that they can be defined, or they can be lumped as either sexism or racism or nationality. Well, you know, if you think about our species more or less being in this form for 30,000 years and how like clockwork women get the short end of the stick, yeah, I think probably over the history of our species, it would be tough to compete with sexism in terms of injustice that our species has endured. If you think about slavery in the United States or the Holocaust, by the way, this picture is from Fort Ontario in Oswego, the only Jewish refugee camp, only major Jewish refugee camp in the United States, which was emptied out just before the war ended, and the Jews were all sent out of this camp and out of the United States. You know, racism is pretty repulsive at its worst. So if you just want to be offended, racism, boy, that's pretty darn bad. But nationality, that's a little tricky.
Manlius Library lecture.
Nationality is a little tricky in that it's not visible to most people where they live. And second of all, nationality has great upsides. It is wonderful that our present setup of a little less than 200 countries has allowed for accountability, both financially and politically, in terms of judicial systems. So I love the notion of nationality in the sense that it gives us the ability to have fiscal and political accountability on a manageable scale. Secondly, if you think about the country of Bhutan, a kingdom, or the country of Denmark, a sort of Western democracy, those two countries are among the quote unquote happiest in the world when people do interviews of people and try to judge national happiness. And yet those two governments have nothing in common. So nationality allows us to have experimentation and to have governance that's culturally appropriate to different people, so that people in Bhutan can have their quirky kingdom where every department's goal is maximizing gross national happiness. And in Denmark, every department can have its sort of Western accountability mechanisms, maximizing gross domestic product, and the structure of their civil society, or sorry, their protective state that they're so proud of. And you know, here are two cultures, completely different governments, and nationality allows us to have like appropriate things for different places, but nationality prevents us from understanding the world. Here is a graphic, it's from a couple years ago, showing the daily income. Most of us don't realize that the median income for a worker across the globe is about $5,000 a year. And once you get up to like $50,000, $60,000 a year, you're in the top couple percentile of the planet. Once you get up to like $12,000 a year, you're in the top 10 percentile of the planet. So we have a world where there are a lot of people living on a couple dollars a day. And we have a few countries that seem to have extreme influence that are living on income, so $10,000, $20,000, $30,000 per person per year. And somehow those can coexist without ever having to conflict with each other or to face each other. And so, you know, nationality has great upsides, but here is a little graphic, and it's showing the mortality rate, the fraction of children who die before they turn 5. And it's expressed here as the number per 1,000 live births. So in the lightest color zone, which is the European nations largely, it is less than 4 children per 1,000 live births die before they're 5. And there is a huge swath where something like, shown in the dark red, mostly in Africa, 30 times that many die before they turn 5. So if we think about structural injustice, oh my gosh, a child born in Nigeria or Mali or Chad has something in the order of 30, 50 times the chance of dying as a child born in the United States. And that's just one thing. A child born in Mali is likely to have less than 1/1000th the money spent on them in their life to get them educated compared to a child born in Syracuse. And we have inequities in Syracuse, but we don't have any inequities where in certain school districts, people are spending 3 times more than in other school districts. So to have 1,000-fold difference in educational spending between countries can only exist if we have this concept of nationality that allows us to sort of say, oh, America comes first, or we are only responsible for ourselves. And the irony of that is most of the European countries and our country start out with a constitution or a declaration to the effect of all people being created equal. We actually don't mean it when it comes to people that happen to be born on the other side of a border. And that's just a bizarre, bizarre thing. So I want to leave thought one. Of all the structural inequities we have, I think nationality is big. You heard in the introduction, the main thing I've done in my career is measure mortality in war zones. Here is, starting during the Cold War and going up till a couple of years ago, the worst humanitarian crises anywhere in the world, expressed as deaths per 1,000 per month in a relatively big population, somewhere where at least 100,000 people were affected. Back during the Cold War, we would have crises where 20 people per 1,000 per month, that's 2% per month, would die. That is pretty darn extreme. That's about the death rate from 1939 to 1943 for Jews in Germany. Like 2% per month is 25% per year. That's a lot of death. And so we've had more and more crises of late, but the mortality, the high mortality events like we saw during the Biafran famine and other things, they're becoming less and less common. And what's becoming more and more common is certain states are what we refer to as failed. So I have a project right now. It's funded by the Centers for Disease Control. And it is a monitoring project to measure the birth rate and death rate in a war-torn, very dysfunctional part of the Central African Republic. The Central African Republic is a very poor state, probably the poorest country in the world. 70% of people don't have access to safe water. 80% of households don't have a latrine. It's got the second lowest life expectancy officially. It's probably worse than that. And most important for our story, this country has 70% of the terrain outside of the government's control, and it's been that way for more than 10 years. So about 40% of the population lives in that rebel-held area, and there are 3 different rebel groups in those areas that don't get along with each other. So here's a little graphic of the Central African Republic. It's sort of south of Chad, north of the Democratic Republic of Congo, and the little red circle that is in the northwest corner, which is right where Chad and Cameroon come together, that's where this surveillance project is located. And we set up to, within this, the phrase is prefecture, but you can think of it as a county, to randomly pick 30 places. And in each of those places, the idea is that we would monitor 15 households by having someone from that community go and visit their neighbors. And that would sort of prevent all the problems of people either wanting to tell a really sad story to outside NGO types, and local people almost certainly know what's going on way better than an outsider ever could. So the idea is to try this sort of experimental way of people monitoring themselves, because people would be better at monitoring their own neighborhoods. And especially in this area where there's two different rebel groups that hate each other controlling the terrain, within each group, it's people who get along with each other monitoring themselves. So we met with local chiefs to help us find a monitor, and we did a little baseline survey and wrote a memo and told everyone that we're going to keep doing this for 3 years. So we interviewed about 4,000 people at the start of this. I won't bore you with the details, but I just will point out that, first of all, the birth rate was way higher than the official rate the United Nations says is there. And the death rate was 3 times higher than the official government rate and than what the United Nations says. Getting back to that concept of nationality, it is very, very rare that the United Nations will contradict a Ministry of Health. And in this case, the Ministry of Health has no incentive to tell the world that in that 40% of the population they don't control, there is a humanitarian crisis going on, and that the outside world should spend all their money there, not on the government-controlled areas. So we've had this now going for 25 months. And what's stunning is that COVID has not arrived there, but health conditions have deteriorated a lot because of COVID. So there was 3 months when the threat of COVID first arose, and there was a bad outbreak in New York City, and there was still a bad outbreak in a couple places in Asia. Many countries decided, well, we should do what the Europeans and Americans and others are doing. We should put lockdowns in place. And they closed all the churches, they closed all the schools, they closed all the big markets. They did everything they could to prevent people from congregating. And that went from March to June, and not one recorded case has arisen in this prefecture or county. If you remember visiting the houses of 2,000 people every month, and we ask, has anyone in this household been sick in the last month, so sick that they couldn't either work or go to school? So we've been doing this for 2 years, and we've got a rate of respiratory infections that's normal. Typically it's 60 to 80 people per month out of the 2,000 say they've had a respiratory infection, and there's been no increase. But what there has been an increase in is violence. It turns out that the border with Cameroon has been closed, and the closing of that border has just devastated the economy, and that has sort of led to strife and tension because these rebel groups that controlled there, the main source of income was charging fees for people bringing truckloads of goods across the border and through their territories. And so all that income has dried up, and violence is way up. People fleeing the area and running to other countries is way up, maybe 3 times higher than it was before COVID came along. It seems that malnutrition has also risen. The NGOs that provide both drugs to clinics and the World Food Program, who typically twice per year would have certain food distributions that would be high in vitamin A and provide some other things that were sort of seen as essential for children's health, those haven't happened since COVID has come. And thus, there's maybe sort of nutritional effects as well. So here, COVID has not arrived, but it might be the worst health crisis they've seen in years because of COVID and the reaction to COVID. Now, as an epidemiologist, we're in a funky moment in time in the sense that my students and probably your kids are more influenced by pictures than they are by data. And they're more influenced by dramatic things that can be on Twitter or on Facebook than they are boring articles in medical journals. And so here's a picture of a child. Most of you have seen it before. It's actually a Syrian refugee child who has washed up on a beach in Greece about 4 years ago. This picture did more for humanitarian assistance towards the Syrians than all the data that's been collected through the entire war. After this picture came out, the European Union, terrified that all of these refugees who were in Turkey and wanted to come to Europe were going to pour into Europe, more than doubled their collective aid to Turkey and negotiated a mechanism by which the Turkish government would keep the refugees there. In the country of Iceland, 1 in 5 households signed up to host a Syrian refugee family in the 2 weeks after this picture was taken. Wow, did this have influence? And so we're in a funky spot. And when I'm trying to understand the sort of role of data, and might I just back up to that picture, and the internet is driven by emotionally dramatic things like this. So when I want to understand something hard, like the degree to which the internet sort of skews humanitarian stories to meet what is dramatic and Facebook friendly, I always ask my students to figure it out. And so in 4 different classes, 3 of them public health students, 1 of them library science students, I or one of my colleagues has gone through an exercise where we lay out to the class which of these 5 conflicts, and this was mostly happening in 2017 and 18, which of these 5 conflicts in 2018 has the highest violent death rate? So I'm asking graduate students in public health. These are smart people who have some work experience for the most part. So they're in their mid-20s, very internet savvy. And I have them sort of break into groups and go on the internet and search and assess and assess and assess. And the 5 conflicts were Venezuela, Syria, Yemen, the Central African Republic, or Mali. And in each of the groups, when they broke apart, I asked them actually to do 3 separate things. I said, guys, in your group, could you make sure that someone searches for this with a general search engine like Google or Bing? Could you make sure someone in your group searches only with an academically constrained search engine like the National Library of Medicine database Medline or Google Scholar or something like that? And finally, I'd like someone in your group not to search. You can't search on the internet. Just go to wherever you think is the most authoritative source, whether that's the Ministry of Health for that country or the CIA fact book or the World Health Organization. And by far, the country that was found by these students to be the most violent was Venezuela, followed by Syria. And the least was the Central African Republic or Mali. And it turns out this is the opposite of the truth. Almost for sure, the violent rate is highest in Mali. It's the place where the most UN soldiers have been killed. The violent death rate in the Central African Republic is probably 4 times that of Yemen, or 6 times or 8 times that of Syria back in 2018. So definitely the Central African Republic is far more violent, but somehow the internet tells the opposite story. And I think there's 3 issues here. That there's a problem of definition. So Google search engine uses the word violent death and murder as synonyms, where the World Health Organization has 5 categories of violent deaths. And most of the common things like the Huffington Post, when they talk about violent deaths, they don't talk about war deaths. So one issue is there isn't a common definition. The second issue is there are certain places in the world, getting back to this nationality idea, that are not well connected. I spent several months working on the Ebola outbreak in West Africa People were very worked up about that outbreak in 2014 and 2015, if you recall. It turns out there have been thousands and thousands of cases every year in West Africa for decades, and we just never knew it. We just never knew it. And we didn't know it because it's mostly in rural areas of people who are extremely poor. If they go to a clinic, they go to a very, very humble clinic that is never going to take a blood sample and search for some exotic virus. And so because these people aren't connected, because people in the wars in the Central African Republic and Mali see no reason to tell the outside world that there was an attack on their village yesterday, and yet everyone in Syria and Venezuela has a friend in Europe or North America and wants to tell them that there was an attack on their village, the conductivity or connectivity of certain populations makes them way higher profile on the internet. And finally, there's a lot of intentional deception out there. On the left is a little graphic about the siege of Aleppo that's sort of showing a girl running through a bunch of dead bodies. It's not true, it's photoshopped, it's just made up, it wasn't true at all. And I've only recently realized that when we were kids, if you remember, Khrushchev came to the United Nations and very famously sort of stood at the podium and supposedly like beat on the podium and said, "We will grind you into oblivion." Most of you remember, if not this, hearing about it and seeing this picture when you were young. I saw this picture on the top, starting when I was like 4 years old, and it is deep in my memory, but it turns out it's photoshopped. And it was photoshopped back in 1960, whenever this happened. And if you actually look how he's holding his shoe in that top photo, it makes no sense. If he wants to beat on the podium, he would have the sole down, not the sole up. And so we've had deception going on for a long time, but it's getting way, way, way more common. On the right is a little cartoon that was in the New York Times last week, and it's always saying like I think the title was something like "The Present View of History." And we never have a pretty good view of history, but I am quite convinced in 200 years in the way people today can't believe there was slavery in this country, especially if you read our Constitution. In 200 years, people will never believe that people lived in Europe and the United States and Canada and could electronically send money anywhere in the world, and yet somehow there were people living on 1% of their income dying at 40 times the rate. Like that's just not conceivable, I think, in the long view of history, and we can't see that yet. And the picture on the left reminds me that one of the things that's keeping us from seeing that is this dynamic that is in the internet. It's it's in social media. This is a guy named Dylan Roof. If you recall, he shot up a church in South Carolina back several years ago. And he was completely radicalized by searching on the internet. And once he had opened up a couple of racist websites, the way the Google algorithm works was every time he searched for anything after that, he would find racist websites. And this guy sitting in his room all by himself became radicalized. And that's a terrifying, terrifying notion. But I contrast this with what just happened in central New York with regard to COVID. On the left is a graphic from Syracuse.com. Thank you to the Post-Standard. And it is showing how really under control New York had this outbreak by June. And this is the whole state, but if we just looked at upstate, there is a pretty similar pattern in place as well. The picture at the top is the Wegmans in DeWitt, and you've probably all seen hundreds of examples of people lining up and spacing. This was before masks were in vogue. This was back in March. I'm not a big fan of our governor, but oh my gosh, has he done a great job. And the part that's been the greatest about him, the part that's been the most out of step with our time is virtually everything he's done, everything he's said, every policy he's put in place has been driven by data based on what the scientific evidence told him should be a cutoff, should be closing a school, should be like changing the status of a particular area. And like, it's just been a lovely, lovely example of governance led by evidence. And I contrast this with every big outbreak I've been in, including Ebola in West Africa, where the rich people think they're above the rules. Once body rinse funerals were outlawed in Sierra Leone when I was there, like, the rich people still tried to do it, and we can talk about why if you wish. For example, the Minister of Health's wife died of Ebola. He hid her body in the trunk of his car and secretly went out and did like the traditional rinse the body, wash her off, and then bury her process. And he's the Minister of Health. And he didn't call the emergency number that you're supposed to call and have the safe burial team come. But New York, like, everyone's following it. And actually the people who aren't following the guidelines are actually the sort of poorest and least sort of advantaged of society. So I am nothing but encouraged by COVID. I am nothing but discouraged by what COVID has done where I work in Africa. And I think that the difference is because we have a high functioning society here, and people stop at stop signs, and when a store asks us to wear masks, we do. And in the Central African Republic, we don't have that at all. So a little bit of corruption can do an awful lot of harm.